I'm Wayne Young. I'm the CEO for the Harris Center for Mental Health and IDD. So here at the Harris Center, our mission is to transform lives. And we found that jail diversion has been a significant contributor towards our mission, and we think it's a critical continuing program for the success of us and for the benefit of our community. So the Harris Center for Mental Health and IDD is the local mental health authority for Harris County, which means we have responsibility for being the safety net behavioral health and IDD provider for our community, particularly for those individuals with really complex situations or serious illness. So we started our jail diversion program in September of 2018, and it was really a strong collaborative partnership. It was initiated through our community. I would say it had tremendous support from the county judge, from the district attorney, from the sheriff, as well as from the mayor and the chief of Houston Police Department. They came with the idea that we create a pre-charge diversion center, and we were tasked with trying to operate that, come up with the clinical interventions, and create a model that would be able to support individuals staying out of the criminal justice system who have serious mental health issues. I think it's also critical to note that when Judge Hidalgo was elected as county judge, she was immediately on board and completely supportive of this same effort. She doesn't want to see individuals with serious mental illness in the criminal justice system if it's not a public safety issue. And so her support, her willingness to get behind this project has been critical since immediately after she took office, and we certainly appreciate her ongoing commitment and support of it.
In Harris County, it's the prosecutor's duty to sort cases between those actions by individuals that are criminal and actions that are less than and should be dealt with differently. Mental health and criminal law intersect on the streets a lot. And instead of filling up our jails with the mentally ill, we've taken a new approach, which is working with the mental health care system, the Harris Center.
Think about an individual with a serious mental illness who maybe is panhandling outside of a business or being a little disruptive outside of a business. And so that business owner or property owner calls law enforcement, they arrive on scene and realize that this person, the activity they're engaged in really is predominantly because they have a mental illness, perhaps also maybe because they're homeless. So the law enforcement officer then reaches out to the intake line at the district attorney's office, and the two of them have a conversation about whether or not this person is a good candidate for diversion.
So in offering police a different tool, a respite center, instead of the jail, they now have an option that was never before available. This has been welcomed with open arms by law enforcement leaders for handling low-level mentally ill offenders.
The steps that the officers go through in order to determine whether or not someone is appropriate for the diversion center, they use their CIT training to determine whether or not there's an underlying mental illness issue, if that has any factor in the criminal offense itself.
Once they arrive at the diversion center, there's a strong array of services that are intended to engage, treat, and hopefully transition those individuals into continuing mental health services. Right away, there's a comprehensive screening and assessment that's done, trying to identify what their immediate needs are. They'll see a psychiatrist, they'll see a primary care physician, they'll have housing assessments, employment assessments. We provide rehabilitation, care coordination services, ongoing case management, post-release or post-discharge follow-up and engagement services, as well as routine medication management, peer support services, and a variety of other supportive activities that are designed to help people. So in our first 2 years of operation, the Jail Diversion Center diverted more than 3,000 people from jail.
So we've seen this program drop recidivism rates. Offenders who are mentally ill, committing minor crimes, are doing it less after they go to the respite center. And some have not found their way back to the criminal justice system at all.
The recidivism rate has proven to be very enlightening with our diversion center. About 20% of individuals are responsible for about 40% of the diversions.
And what we found is that across the board, individuals who were diverted, when compared to a similar like group who were not diverted, they were 1.4 times less likely to return and be booked into the county jail on a new charge. And so we looked at a subset of those individuals who'd been arrested 5 or more times in their history and found that that group who was diverted compared to a group that was similar that was not diverted were 3.1 times less likely to be rebooked into the county jail on a new charge than those who were not diverted.
The Houston Police Department responds to about 45,000 crisis intervention calls every year. So the ability to have something to do with the mentally ill individuals, other than necessarily taking them to the hospital or taking them to jail, is definitely a tool that has been helpful.
In fact, we partnered with an outside agency, Justice System Partners, to come in and do an external evaluation of our program because we really wanted to know how did that return on investment work, what was the impact we were having. What we found is, in terms of the return on investment, for every dollar we spent on diversion, the county avoided $5.54 in criminal justice costs.
As a result, others are looking at us from around the country, and we're able to offer the story about how we, as a bipartisan group from different branches of government, came together to solve a major urban problem.
Any agencies that are trying to put something like this together is to make sure that early on in the process you define what success looks like. So I'm talking about overall success plus success for each agency involved.
And so I think it's important that we understand our impact and we have the forward-looking activity and evaluation. But here and now, today, 3,000 people in the last 2 years did not go to jail. And what we found was that within that same group, pre-intervention, pre-diversion compared to post-diversion, those individuals had a reduction in rebookings in the county jail by almost 50%. We want to keep people with mental illness out of the criminal justice system. We want to reduce the footprint of the criminal justice system in the lives of individuals with serious mental illness. We think the Harris Center should be the entity to kind of help move this forward. It's a tremendous opportunity that was borne by our elected officials and leaders in our community.